We look next at two types of two types of methods, for sample collection for gynecological issues. Maybe a woman is actually having issues, in her reproductive tract. So you want to actually collect sample, all right? This sample, you use it in the lab to be able to make diagnosis and all of that, okay? So one is known as vaginal swabs, the other one is known as cervical swabs, all right? So let's quickly look at them, all right? And basically their applications, so to say. So they are very important diagnostic tools. They help you to be able to dictate infections, screen for sexually transmitted infections, and also just access the general sexual health of the individual. Okay, so if you are saying vaginal swabs, you are collecting sample from the vagina. If you are saying cervical swabs, you are collecting sample from the cervix. Do you understand? So what are they? Vaginal swabs, you are collecting secretions and cells from the vaginal walls. Cervical swabs, you are targeting the cervix. Okay, that's the lower part of the uterus. Of course, here you want to dictate infections, or you want to see that maybe there are some abnormal cells that is leading towards cancer. Okay, so the swabs will help you to test for what? STIs, that's sexually transmitted infections. Help you dictate bacterial infections and yeast infections. Help you dictate Pap smears and human papillomavirus. Okay, then microscopy and culture, just to identify pathogens. Okay, and know which type of antibiotic to actually opt in for. So you can see how this is a cervical swab. I'm using a brush, okay, trying to scrub it on the cervix, pick up some cells for testing. So types of swabs used: you can use a NAT swab, that's for nucleic acid amplification testing swab. Could be charcoal swab, could be viral swab, depending on the clinical need. Do you understand? Sometimes you might actually want to combine them. So how the procedure works is the patient has to lie on an examination table. Then you use this iron that is keeping the vaginal patterns. It's called the speculum. Then swabs are gently rotated to collect cells and secretions. So samples will now be sent to the lab to see if there's any analysis, then collect the results. So why are they recommended? If the patient is having irregular vaginal discharge, if there's pain, if there's itching, if there's burning sensation, if they have had missed or irregular periods, if they are suspecting that there's some sexually transmitted infections, you might want to go in for any of this, okay, just to help you dictate depending on the area which is of interest to you.